Hello, I'm Bill Hurl, President and CEO of Immunomic Therapeutics. I'm here to provide an update to HLB shareholders on the Phase 2 study of ITI-1000, our glioblastoma or GBM dendritic cell vaccine for newly diagnosed patients. Before I go forward, I wanted to point out that I'm going to be making forward-looking statements, and we have a safe harbor statement that will apply to this presentation. GBM is widely known as an intractable disease that has not had a new treatment approved for almost 20 years since temozolomide in 2005. The 5-year survival rate for these patients is only about 3%, and countless GBM patients are desperately waiting for the development of a new and effective treatment. While drug companies have attempted to develop new therapies for GBM, none have produced any significant results to date. However, ITI's ATTAC-I study, conducted at Duke University, extended the median overall survival for patients from the typical 14-month survival to over 40 months of survival, thus attracting great interest within the academic community. Accordingly, since 2016, we've conducted a Phase 2 study, which is known as ATTAC-II, involving 154 newly diagnosed GBM patients. Last month, we reached a key program milestone, and the analysis of patient data commenced at the University of Florida to analyze the data from both clinical sites to determine whether the primary endpoint of overall survival is met. We are aware that many HLB shareholders have long anticipated the study results. Therefore, since the start of data analysis, we have coordinated closely with HLB, who continuously has pushed for a rapid completion of the data analysis. While there were some delays caused by the Florida hurricane, I believe that given the study size and progress being made, initial data analysis would be completed no later than the end of this month. I communicated this timetable to HLB, who I believe made the information publicly available to all of its shareholders. Although active progress is being made in the analysis of the data from each institution, the combined analysis of the data from the two institutions together is taking longer than expected. In particular, while ITI would like to announce the key top-line results when ready, the principal investigators who conducted the study at each institution, given the level of interest among their academic colleagues in the field, prefer to complete all detailed analysis and present a comprehensive report at a suitably prominent scientific conference. We are still negotiating a mutually acceptable outcome for all parties. Nevertheless, we at ITI believe that the ATTAC-II study will show that ITI-1000 provides significant survival benefit to glioblastoma patients compared to currently available treatments. Moreover, since patients have not experienced significant adverse events, we have also established the safety of the therapy in a large segment of patients. At present, there are over 30 patients still on study, in follow-up, or in treatment. So with each passing week, the survival results, particularly for those patients that are already in the long-term survival category, continue to improve. As soon as the data analysis is complete, we will report the results in a scientific conference or through other channels. We ask for your deep understanding and patience. As rapidly as the data is progressing, ITI and HLB are making plans for rapid progress of post-Phase 2 development. We will focus on validating our commercial cGMP manufacturing process, which is key to the commercialization of any cell therapy, while working with HLB Therapeutics to establish the Asian Brain Center, thus expanding the foundation for future global clinical studies and commercial access. We believe we will soon be able to announce the good news of the first new treatment for glioblastoma in almost 20 years. Until the announcement of the study results, we ask for your continued interest and support. Thank you very much.